Sorry, not programme. I expect most of you know me. I'm Councillor Jill Slocum, and I welcome you all here today. I like to be known as chairman, but nothing else rude, please. Even if you feel like it, you can say that to me afterwards. I will address you as councillors with your surname, because I think members of the public, it's good for them to know who is speaking at the time, and that has come out many times. So if that's all right with you, I hope it is. The agenda pack with papers are available via the ModGov directly from the council website, from the link which was sent out to members. So I hope you've all been able to have that. In line with the recommended meeting procedures, I'm requesting that all members and officers turn off your microphones and videos, please, because obviously the background noise can affect the quality. When I invite each person to speak, I would ask you to clearly state who you are for the benefit of people listening, and so they can identify you. Can I also remind all council committee members to use the chat function solely for committee purposes? Otherwise it's slightly distracting. Can I warmly welcome you all, and members of the public and the media who are joining us today. And can I thank officers here, all officers that are here today, and I really appreciate what you're going to put into this today. Can I also thank the executive members that are here, and many others that so welcome to you, because it's good that you're here. Finally, as the agendas are now viewed electronically, could I request that members and officers refer to the page numbers from the published agenda pack to assist in the present in finding the appropriate information that you may need. So as I say, please, if you could just, I'm trying to learn all your names. If you could just say your name when you speak, I would really appreciate it. Thank you very much. Item 1 is apologies for absence, please. Jenny?
We have apologies from Councillor Emily Pearlston, who has sent a sub, Councillor Henry Hobhouse. That's all.
Welcome, Councillor. Thank you. Item 2 is declarations of interest. I think we all know this. We have a list of your town and parishes that we know you're on. If anyone else has any declarations of interest, speak now. Right. Item 3 is public question time. As you will see, we are timing this today to make sure that we keep it succinct and we don't run over, so everybody has equal time. So we have 2 speakers, and the first one is Eva Brychowski.
Eva Brychowski has contacted us this morning to say, because she was after a parking space, but she's not in the room at present. What we could do, Chair, is defer her question until before the item itself. Right. Okay. So that she doesn't miss out. She has been in regular contact with us. So okay. So we'll go to Mr. Rick Beaver. Thank you very much.
Thank you for the opportunity to speak on behalf of the Quicksilver Community Group to support the online petition we've already submitted to the Council. I refer to your public agenda pack, pages 15, 16 and 17. Number 16, Somerset Hyperacute Stroke Services Consultation. Agenda item 7, I think it might be agenda item 8 now. This reflects your previous discussion of the report about the public consultation on stroke services in Somerset. In the report, reference is made to the vision behind the consultation, and it's to ensure stroke patients in Somerset will receive timely acute interventions and receive access to world-class services regardless of where they live. It's also noted that most people with a suspected stroke are admitted via a 999 call to either Musgrove Park Hospital in Taunton or Yeovil District Hospital in Yeovil. It acknowledges that journey times are a challenge due to the rurality of the county. Only 2 options are proposed in the consultation. Both involve the closure of the hyperacute stroke care service in Yeovil District Hospital. It's frankly incomprehensible to have a vision of stroke patients receiving timely acute interventions, regardless of where they live, while acknowledging that a hyperacute stroke care service in both Yeovil and Taunton, that journey times are a challenge, and then propose to remove the facility in Yeovil. I note also the recent Somerset Live report that our ambulance service has the longest wait times in the country. The Quicksilver Community Group picked up on this late, I think because the consultation had been about the future of the acute stroke care facility, not the more critical hyperacute stroke care facility. An online petition had been arranged with, and within 2 weeks had 2,000 signatures and is currently well over 5,000. We presented this to the full county council meeting last week and would have advised that the matter would be discussed further at this meeting today. At the full council meeting, I was grateful for the opportunity to outline the impossibility of meeting recommended onset to treatment time of 45 minutes for stroke victims for a large area currently supported by YDH if the hyperacute stroke care facility is located just in Musgrove Hospital. Delays in treatment result in less successful recovery for the patient, with life-changing consequences for them and their families, and additional care requirements which will impact on the council. We believe the public consultation arranged by NHS is effectively meaningless, as the most critical aspect of the change is the removal of the hyperacute care service at Yeovil. Our question to you is to ask you to recognise the strength of feeling, the fear of the risks inherent in the proposal, and ask what you are currently doing and what further actions and influences you can have to get these proposals reviewed and rejected. Thank you for your time and consideration on this critical matter, which affects such a large number of Somerset constituents. Thank you.
Thank you very much, Mr. Beaver. Thank you. As you know, we are discussing this on agenda item 8, so hopefully you'll stay. But thank you for that. Do we have
Councillor Ruddle.
Oh, thank you.
Thank you very much for your question. We are, of course, very concerned with the potential closure of this facility in Yeovil. I am aware councillors have already responded to consultation and we are continuing to listen. However, the decision is with the ICB and the NHS, but ultimately with the NHS, not Somerset Council, that will make that decision. Thank you.
We don't have Eva?
Not yet. Suggest we move on.
Right, okay, thank you very much. We will obviously allow Eva to speak when she comes in, hopefully that you'll accept that. Item 4 is the work programme, and this is where we add new items to the forward plan, agree the proposed items for the next agenda. Have you seen, everyone has seen the work programme? Is there any comments? Councillor, can you?
Yeah, morning Chair, Councillor Andrew Govia. I was going to be, to use Mel's words, very grumpy about this particular item because I was particularly, you were present, I think, online last time about when we discussed it, and the issue that I raised and other members of the committee joined in was around dentistry and the fact that the service in Somerset is, well, it's appalling, to be frank, and we did ask for that to be urgently addressed, and I was disappointed to see when it's actually coming, because I don't think it's actually coming until October. But I have been in conversation with Mel Locke this morning to say that the ICB have only just taken over dentistry. She accepts that it is something that needs to be given as a priority, I think, but that they won't have any meaningful information till October. But I do register my, dissatisfaction with where we are with it, because this has dragged on now. We had a briefing from the NHS over was 16 months ago now, when they said they were just about to reveal plans to roll out NHS dentistry across Somerset. Nothing's ever happened to that, and people are having to either pay a fortune or suffer in agony. So I'm happy that it's on there. I'm disappointed when it is, but I accept the rationale behind it. And the only other timetabling matter was which I also mentioned, would have liked to have seen come earlier, is the winter plans, and they're due to come in December, and I think I understand there might be a rationale behind that, but I do feel that is a little bit late, because we are already a couple of months into winter when they would be discussed, and I would have thought that they've been timetabled a little bit earlier, if that is at all possible. Might be a way forward. So it was just those couple of things, but I'm less grumpy than I would have been originally. So thank you, Chair.
I'm really glad to hear you're less grumpy, because obviously as the new chair, I want everyone to be happy, or happy-ish. Mel, do you wish to say anything on that, please?
In terms of dentistry, yes, we know dentistry is an issue across Somerset and the rest of the country. However, when it came here, it was the NHS centrally were delivering that function. It has just come to here to Somerset ICB, so they will bring it here. but we need to give them a little bit of time to get their strategy in place and work through that. So it will come, but please, that'll be a bit later. In terms of the winter plan, I think you're absolutely right. We should be submitting winter plans probably October, November time. So I'm more than happy for those plans to come here. October, November time would make sense for you, no problem.
Sorry, just to tell you as well, when we did the forward plan, when we discussed it, I think I drove everyone mad because I wanted everything like you. I wanted it all now. And then I realised it's got to be spaced out and you've got to wait for the appropriate people to come and talk. So obviously I've had to learn things as well. So can I go to Councillor Shearer, please?
Thank you so much, Chair, and forgive me for I was trying to hold back until everybody from the membership had their say. I just want a couple of things I just want to say in case they don't get missed. Really, at the last meeting when we had that very helpful discussion or update from the South West Ambulance Trust, I think you'll see in the minutes they said they were going to come back in 6 months' time. Now that might just come back as a report, but just in case, I didn't know if that had to be in your work programme, so as not to miss that. And the other question I just had, and again, I'm sure you're ahead of this rather than I am, but I know it's been something this committee's been keen on and I've been keen on for a while, is to see the dementia strategy that I know that we've been working on. So again, if that could be planned in at some stage, I think that'd be really helpful.
Thank you very much for that. Very, very important. Thank you very much. Can I go to Councillor Osborne, please?
Thank you, Chairman. Heather beat me to it over the ambulance item. That does need to come back, and it was agreed it would come back 6 months later. Also, as well, one of the things that we are supposed to have remit over is the Armed Forces Covenant. And I see on the work plan that there is no provision for looking at that. I think it's probably something that we do need to do, is look at how well it's working, how it can be improved, and that we really are active in that area, and it's not just there to tick a box.
Yes, thank you very much. I think they are important items. Thank you. Okay, Councillor Sully, please.
Thank you, Chair. I've got deja vu here. I really would like, and I hope my colleagues agree, that suicide prevention is on this work programme as it's ongoing, and it's something that affects all our communities, with double the amount of people die through suicide than on our roads. And if it was equivalent of 10 Boeing 747s per year, and I believe and we were on a sort of training, we're on a journey as a committee, and some of us have done some training. There's opportunities, but it's very clear that it's something that should be addressed in our communities. And the lead member, Mel's, also said that we're champions for our communities. So I'd be very disappointed if suicide prevention, having the latest as to what programmes are doing and achieving, reported to us in our work programme. And it was put on last year. It wasn't on last year, but it was put on. I'm just disappointed to see that it's not on again. So please, can we have it put it back on? Thank you.
Thank you very much. Councillor Bruce.
Thank you, Chair. Yeah, it was just, we have a workshop set for the review of mental health services, county-wide review. That workshop's in June, I understand. I can't remember the date particularly, but it's not mentioned on the work programme at all. And I think possibly we need to have a section in this work programme that talks about workshops that are ongoing. I would just like to ask if you can take the opportunity today to remind people that the workshop is scheduled. Can we confirm which committee members might be taking part in that? And just a bit of clarity in terms of, are we setting terms of reference for that workshop that day? Are they going to come in advance of the workshop? Is it just going to be a one-off? Are there going to be a few sessions? I've got a few questions about it that are still unanswered. Thank you.
Hand over to Mel just at the moment.
No problem at all. So we will have a workshop. If you want to set terms of reference for that workshop, I wonder if we have the workshop, we then make a decision there whether you want a small working team as part of that after the meeting. Let's have a workshop where we discuss openly what we're doing. We can, as part of that, then make a decision about, is there particular pieces that you want to have a task and finish group to look at as part of that or not, and you will make that decision as you come. But it would be really good to Obviously, it will be open to all members of Scrutiny and others if they want to attend. So we'll need to get that out.
Okay, that's great. Thank you.
Can I just say as well, the workshop, apologies, that may be not my fault. The date may be changed because we need to make sure this is coming up to holiday period. We want to make sure we've got the right people in place. So I think throughout this meeting, we'll be able to perhaps find out when we think that'll be best. But we will make sure everyone knows, okay? Because I know how important that is. Thank you. Okay. So is anybody else wish to say anything about the work? Anyone else want to speak on the workforce? The work plan programme? Councillor Osborne, sorry.
Yes, Chairman, I'm just looking at this, but it might come up in the item 8 on the stroke consultation. We haven't got anything sort of nailed into the work programme as to when this is going to come back to us or how that sequence is going to work. I don't know whether you want to do that now or wait until item 8 and what comes out of that.
We'll wait till item 8 if that's okay.
Thank
All right. Thank you very much. Yeah, I think it might be a little bit, things might be a little bit clearer then. Thank you. So moving on now to item 5, which is the minutes of the meeting held on the 8th of March, pages 13 to 20. Can I have agreement these minutes are correct, please? Thank you, Councillor Woods, as if I would forget. And a seconder? Councillor Gover. Thank you very much. Thank you. Is there any, does any matters arising? Do you do that? No? No matters arising, so it's good. We now go to item 6, which is the workforce planning. This is on the agenda, pages 21 to 26. And I would like to invite Emily Fulbrook to introduce this item on the report and give a presentation, please.
Thank you, Chair.
Thank you, Chair. Thank you. Just to let you all know, if you don't know me, my name's Dean Ruddle. I've been here quite a while, actually, but I've been hiding in the cupboard. So I'm the new executive member for Adult Social Services. I've taken over for Heather, who's done a fantastic job, and I thank her very much for all her hard work she's done. I apologise to you all. I should have said good morning to you earlier. So good morning to you, Chair, and good morning to members. And it's a bit colder this morning, actually. I might have to put my jumper on. So Emily has done a fantastic job, and I'd like to thank her and her team for this report. It's an amazing report. It goes into the challenges that we're all facing, not just in Somerset, but across the country. So I will now pass over to Emily. Thank you.
Sorry, Emily, just before you start, sorry, I'll keep stealing your thunder. Members will see that there is a presentation on the screen. It's my oversight that that hasn't been shared with you in advance of this meeting. That's not Emily's fault. So any comments about that you haven't seen it before, please direct my way. We will obviously circulate after the meeting.
Thank you all. I'll make a start. So this presentation is, you've got the report that has been completed, but this just gives an additional information and just pulls out some of the key information within the report. So this is a presentation surrounding workforce planning within adult social care, both internally and externally within our provider market. So in Somerset, part of our strategy is that we want people to live a healthy and independent life, supported by thriving and connected communities with timely and easy access to high quality, efficient support when they need it. So this is what people tell us. So people tell us that they want to live in a place that they call home, with people that they love and communities that look after each other and doing the things that matter to them. So achieving this vision is reliant on us having supported, skilled and a flexible, sustainable workforce, both internally and externally. Go to the next slide, please. So what does the national picture tell us? So with over 1.65 million jobs, the adult social care workforce is larger than NHS, construction, transport, food and drink services industries, with a number of the jobs forecasted to grow by 1/3 by 2035. The sector contributes 51.5 billion to the economy and that was in 2020, 2021. But however, we know that there are workforce pressures and challenges across the country within adult social care. CQC's annual report that was published in October 2022 highlighted ongoing struggles with recruitment and retention and making sure that staff have the right skills, the right numbers to meet the increasing needs of people with care and support needs and alongside any of the demographic challenges as well. So this is the information from Skills for Care. Appreciate you might not be able to read that detail, but this was the latest available data that came out 2021-2022 relating to Somerset evidence, and this shows in terms of the workforce sector. So this is in our provider market. You can see there that the vacancy trend has increased in both our nursing homes, residential homes and home care as well. The graphic on the other side really looks at in terms of what's the trends, what's the sickness, what's the turnover, how we recruiting, and what you can see there is 73% of the workforce is recruited from internally within the sector as well. So it's making sure that we're striving to bring new people into that sector rather than sort of regurgitating in terms of within. We go on to the next slide. So in terms of locally, so internally, what are we doing? So for our internal social care workforce, we've got a workforce strategy that has been developed, so covering from 2022 to 2024, which really sets out our commitments and activity to support our internal workforce and looks at specific challenges in relation to recruitment and retention. We are planning to do an annual review of this in June 2023. Our workforce board meets on a regular basis. It's on a monthly attendance, and that's supported and attended by service directors, strategic managers, our HR business partners, and we review the progress that's set aside in terms of the workforce strategy and look at our action plan monitoring and looking at our workforce data. We've had a recent swap audit of the adult social care workforce planning, which was published in March 23, which had a reasonable assurance rating. Comments were that there is generally a sound system of governance, risk management and controls that are in place. The audit recommendations informing annual review in 2023, which is what we will be completing. This just gives you just gives you a bit of an a graphic in terms of our workforce strategy and some of our ambitions. So this talks about things, if I can just pull out a couple of them on here. So ensure we attract and recruit sufficient numbers of talent and skilled employees, identify and grow talent internally, provide opportunities for staff to fulfil their career ambitions, increase opportunities for younger people, invest in learning and development and excellent career pathways, learn, share and grow our system partners in order to improve outcomes, and be open and transparent with our staff about progress being made on our workforce plan. If we go on to the next slide. So as part of the workforce strategy, we are undertaking a restructure within the adult social care operational teams, so our frontline social care teams, and it's currently underway at the moment. It's a large-scale adult social care operational restructure that is being completed over 3 phases. So phase 1 commenced in December 2022, and that set the senior management, the management structure was set there in phase 1. We've started our recruitment. We've got strategic level recruitment is now largely complete, and we're moving on to our service manager and our advanced practitioner roles. And we've got interviews taking place this month and next month. Phase 2, we launched last week, and phase 2 sets out then the teams. So the phase 1 looked at the senior management structure, and phase 2 is really looking at that team structure. We're looking at an implementation in July 23. This is an engagement, so it's not formal consultation, as we're not removing any posts or we're not changing any posts as part of this, as part of phase 2. And our new adult social care strategy also places a clear emphasis on the need to prioritise and invest in our workforce in enabling supportive skills and a flexible workforce. This just gives you an overview from May 2022 to May 23 in terms of new starters across the various different frontline professional roles. Won't dwell on that too much. And then there's some data here surrounding some of the turnover within adult social care. So this is internally, so our frontline workforce. So the bar chart on the left-hand side shows the turnover since 2017, and it related to the Somerset County Council rates at the time. So this was taken from 2021 to 2022. As you can see there, the average across Somerset County Council at the time was 13.94%. So adult social care was in line with that. The data that we've got at the moment, so since October 2022, we've had 24 leavers so far. So looking likely to be a similar turnover rates this year so far. Over on the right-hand side, you can see how we fare across the Southwest as well, in terms of our neighbouring local authorities. And we're probably average in terms of where we are in terms of our turnover, vacancy and recruitment rates from a Southwest point of view. If we go on to the next slide, so what are we doing? So as part of our workforce strategy, and definitely in line with our restructure, we've got a lot of recruitment activity that is taking place. We've done some international recruitment, so we aligned with children's services who have been doing international recruitment for some time, and we've explored this within adults, and we have now 15 social workers that have been supported through that international recruitment process. We're looking at our links in with our universities, so really sort of looking at our newly qualified social workers, newly qualified occupational therapists. We're looking at the return to practice for those individuals that have been out of social work or occupational therapy for some time, how we're supporting them back into the profession. We've got a variety of different recruitment strategies, so including sort of videos of individual social workers and occupational therapists talking about their role within Somerset Council. We've implemented recruitment rotas. We're looking at trainee AMP roles. We've got a targeted campaign. With community care and the Royal College of OT. We've updated and refreshed our recruitment adverts as well. We're looking at some infographics, and we're looking at, alongside the Workforce Board, looking at other options that we can do to really explore and utilise social media to attract people into the roles within Somerset Council. We go to the next slide. So our international recruitment, so we've got 11 overseas experienced social workers being recruited into adults. There's a lot of learning that we can gain from those individuals. There's also a lot that we can gain in terms of from the Southwest as well. So we're doing some work with our colleagues within Devon to look and make sure that we are sharing the right toolkits to support people to come over to the UK, but more specifically into Somerset. We go on to the next slide. So our retention, so we really do also need to focus in terms of our retention. So we're undertaking welcoming calls, we're improving our inductions and supervisions and appraisals. We've enhancing our Grow Your Own scheme and our opportunities for apprenticeships. We're really working hard in terms of the exit questionnaires, so we can really capture the reasons why people are leaving adult social care. We've got a real focus in terms of wellbeing for our workforce, and we're launching the new learning from serious incidents process as well, so we can support our workforce in terms of the approaches that we're using, and we're investing in terms of psychological safety across our teams. We go to the next slide. So in terms of what we're doing externally, so with our Somerset independent care provider workforce, so we recognise the tremendous amount of importance and value that our wider independent social care workforce brings to us here in Somerset, and we rely upon them heavily to achieve our overarching vision. So we benefit in Somerset for having average levels, higher than average levels of good or outstanding care quality commission rated provision, and recognise the significance and growing pressures that our care providers are under, both in terms of recruitment, retention and sustainability of their business financially. So the end of the freedom of movement within the EU following Brexit has meant that providers are now having to recruit internationally via Home Office sponsorships, which we've worked with providers to help with the cost of international recruitment, and have seen a large increase in the amount of capacity available in the home care market in recent months. And in turn, we have then seen a reduction in the daily average number of people waiting for care in their own home, and dropping from 111 people at the end of August 2022 to at the end of April just having 4 people with unmet needs waiting for care. Go to the next slide. So we're also working in terms of Proud to Care, and I hope many of you have seen the videos that we've published in terms of Proud to Care. So it's an initiative that started in the Southwest, and it's designed to raise the profile, the values and the opportunities that exist within the care sector and across the Southwest, supporting the development and care awareness and appreciation of paid care, unpaid care and community awareness. It's about encouraging retention within our workforce and using many forms of social media to support the appreciation and development of the care market. It's promoting local job vacancies at no cost to the provider. So you can see some pictures there of a recent event that took place in Taunton of really promoting in terms of the Proud to Care in Somerset. And this is the campaign that we launched alongside in collaboration with the ICB as well. So this was launched, and it's My Time to Care campaign, and it was 6 videos that were launched. I'd encourage you, if you haven't seen them, please go and have a look at the videos and share them wherever you can. What we do know is that this, following the campaign, had a real it significantly increased the number of people that were interested in entering into a career within adult social care. And at the early May, so 130 candidates have been matched to vacant roles across Somerset, with more waiting. So it's a great campaign that's absolutely proved its worth. If we go to the next one. And these are just some of the other campaigns that have been running as part of Proud to Care. So we've had the launch of My Time to Care campaign. We've held recruitment events within the County Cricket Club. We've in March, our adult social care fees and charges were published, and there was we invested quite heavily into social care, so it's a 24.9 million investment into the sector. We've had the jobs fair in Wells, we've done the Eat Taunton festival, and in June we've got an international recruitment masterclass. There's some captions there from people that have come into employment via Proud to Care as well. So there's an awful lot going on in terms of with our private market as well. And that's it. That's my presentation. Thank you very much.
Thank you. Thank you very much for that. Thank you. It's very, very interesting. I think the first person who wishes to, do you wish to say anything first? Councillor Osborne.
Thank you, Chairman. First of all, as opposition spokesman for adult social care, I'd like to thank Heather for all the work that she's done in the last 12 months, and the mastery of her brief in such a short time has been nothing less than impressive. And I'd also like to welcome Dean to his new role and wish him the very best of luck in what will be a very challenging and demanding portfolio. Question I do have for Emily, and it might overlap with the item on Newton, is how is the embedding of Newton staff as proposed? How's that going to impact on your workforce strategy, particularly from 23 to 26, 27? And will any tweaks or reviews to that strategy going forward come back to this committee?
We could probably pick it up in the next item, and it probably makes sense to pick it up in the next item. So if we do it there, would that be okay? I'll keep that on.
Councillor Sully.
Thank you, Emily. Really comprehensive. I've recently done some research and work around gender pay gap at Somerset Council, which means, but broadly, it reflects how an organisation looks after its people. So the opportunities to progress, flexible working, leadership programmes. All those are factors of why we stay in our jobs. And my questions are: what proportion of the workforce are female? What pay quartiles are the roles, i.e., 4 pay quartiles, and you have the 2 highest and then the 2 lowest? The significance of the gender pay gap, is that something you address in your strategies? Because I apologise if I missed it. I don't see reference to gender in any of the data. Thank you.
I haven't got the detail to hand with me at the moment in terms of the breakdown, in terms of women employed, males employed. I can get that to you. We've got it, and we had it recently at our workforce board, so I can absolutely send that through. As for me, there is no gender pay gap at all. That doesn't factor within from an internal within adult social care.
Come back. So gender pay gap's not equal pay, so it's really easy to misunderstand that, but it's about, it reflects the opportunities for all, so it's not one gender or the other gender. There is a pay gap at Somerset Council, so I think it's more about, my angle really is keeping people in jobs because they progress and it works in a way that attracts the right people for the right positions before they apply. So that's where I'm coming from, but it's not the same as thinking of it as one-dimensional equal pay. Maybe an ongoing conversation.
Yeah, absolutely. I'm happy to pick that up and to share with you the workforce strategy as well in terms of what we've got, because there's much more detail within the actual strategy. I've just checked in with my colleagues. It isn't public facing, so but I'm more than happy to share the link out in terms of with the strategy, and can pick up those nuances with yourself as well.
Can I have Councillor Bailey, please?
Thank you, Chair. Yes, I'm a new boy here as well as Dean, so some of the questions I'm going to ask may be from that perspective. The first question I've got really is a specific one. It mentions on page 23, 10 themes or priorities, and I couldn't actually pick those up in the document. First of all, sorry, apologies. Thank you, Emily, for an excellent document. The 10 themes or priorities under 4.3 and page 23. And perhaps that might be just me being new and I need to just sit down with somebody and not wait down the rest of the committee today. Would that be best?
That's fine. What you're picking up there is the themes within the workforce strategy, and I appreciate that on the document it's really small in terms of being able to see those, but within the strategy it's all detailed within there, so I can absolutely share the link with that for people.
Okay, thank you very much. And my next question really was the excellent document and all a lot of good work's going on, obviously. I couldn't really see any measures of success in there in terms of what was trying to be achieved in terms of, for example, just reducing the wastage, increasing retention in any particular time period. I wonder if it's possible to, and again, that may be because I'm new to this, but I was able to see the work, put in, but not the results that are anticipated or hoped for.
So across, if we look at that from an internal point of view, so again, the strategy has an action plan that sits underneath it. So when we're looking at the adult social care restructure internally, so looking at our frontline staff, there's a lot of metrics and benefits that are associated to that. And that's looking at some of our performance, some of our targets, making sure that we're meeting people's needs in a timely way. We've also, in terms of from the our provider market, we've seen the benefits within that. So in terms of home care reducing, in terms of vacancy rates being filled, people being able to be supported within their own homes, the increase in terms of nursing care, so we can support people to have their needs met. So that is all included within there. But again, I think some of what you're asking will be included in the workforce strategy.
Okay, thank you, Emily. Thank you, Chair. I think that covers it. I'll be brief.
Can I have Councillor Hobhouse, please?
Thank you very much indeed. I am but a substitute on this committee today. I have two questions. I have an extremely good in-house caring company called Core Associates based in South Barrow. Ross Perkins, if you need any more, Mel. You don't know him? You do, yes. And we have lost one of our care homes in Castle Carey, and it's all the same problem, which is that the Newt has employed 541 people locally, and we have almost nobody available for employment. How are you working with the suppliers to help them bring in new employment people on a private company basis?
It doesn't matter whether it's a private company or not. Our Proud to Care campaign is about recruitment into the care sector. We also have over 400 international individuals that have come into Somerset. We produce there on your documentation the 111, which goes up every day of the week, that have come into our domiciliary care providers. So what we do is we do support our providers to have a look at and share how to do that international recruitment. You will be aware that government have just given additional funding for each area that chooses to go for that funding. And as from a Southwest point of view, we have just been given, and it is to cover the whole of the Southwest, just over 1 million for this year to be able to look at international recruitment. What we've done with that is we've asked our Care Provider Association, who supports us across the lead Care Provider Association across the Southwest. They actually come from Gloucestershire. So the Gloucestershire provider has just finished for us, working with our providers, a real guide to international recruitment and ethical international recruitment, because what we don't want to do is enable people to come in here. Housing is an issue for everybody, and make sure that housing is appropriate for people. They get the right support, and we have some groups around us that actually people can get together, so that cultural support is also available. So that has started, and that is available for all. Emily talked about actually how are we doing this across the Southwest. It's just come into us. You will see that developing as we go forward in the year. So if I'm very honest with you, we are desperately trying to get people from Somerset to work in care. It's really difficult, whether that be working with our schools, our colleges, whether that be growing people and finding Proud to Care is all about how do we make this a role that you really want to go to. There is career prospects in this. We're also looking with our health colleagues to say, actually, how do we together look at what the role is that we need out there? Nationally, pay is an issue for everybody, and we can only pay as much as we get given by government to actually be able to pay for this. You know, if I could pay above the minimum wage, which we do, but above that, so that we're over and above what you're getting if you go to work for Lidl's or anywhere else, we would do that. But we've put the price up to £25 an hour that we pay our care providers. That has our domiciliary care providers. That has brought more into the market, and you can see that both international recruitment and paying better for that market has reduced the unmet needs in there. So we are doing all of that to help. People can go on our Proud to Care, they can go on our website, and we can match with that. Things we're doing. Is it going to solve it all? Of course it isn't. And I think that's the bit that you have to recognise. We're not going to be able to do this for everybody. We know that with the NHS, whatever pay they they eventually get, and no disrespect to them, they need the pay, I'm not questioning that at all, but that then hits onto our care homes and the nurses within our care homes, so the pay continues to go up, and there is only so much amount of money we can put into this as a local government at this moment in time. That's probably, we're doing lots. Is it going to solve it all? Of course it isn't, but that's as much as we can do.
Thank you, Mel. Can I go to Councillor Bruce, please?
Yeah, a question really about your strategy. I understand that you're using.
Councillor Woods, I do apologise. It's Councillor Bruce. I went to.
Sorry.
Sorry, my diction probably. Apologise, Councillor Bruce.
Thank you, Chair. Yeah, thank you, Emily, for the report. Clearly, there's a lot of work that's ongoing. I I find it a little bit difficult to see whether what's being proposed as the actions actually will solve the problem, because I don't see in the report really anything about what the barriers are. I was really pleased to see that there's more work being done on the exit questionnaires. I'd be really curious to know what that feedback is from people who are leaving our employment, why they're leaving, and I guess that's the workforce board that goes into that in more detail. And I'm just curious as well, the workforce board, who do they report to? And can members have any involvement in terms of monitoring that work that's going on? How often is it coming back to somebody? It needs, to me, ongoing monitoring to see whether that strategy and the planning is on course and doing what it's supposed to do. But I'd just like to understand a bit more about the background of the actions that have been proposed. And also the other question for me is in terms of pay. I didn't see much in the report in terms of, there's a bit there in terms of how we compare for turnover, but I didn't see anything in terms of how we compare for pay and whether we're losing staff to other local authorities, other areas, that sort of thing. And the other thing was, do we have a figure for the current vacancy rate, or when is the 2022-23 rate going to be published? Thank you. Sorry, a lot in there.
There's a few questions in there, so you might need to prompt me on a couple of them. So yes, in terms of the vacancy rate for skills to care, that won't come out. I don't think that's until sort of June, July time, and then that will be for sort of last year. But again, when those up, we can make sure that is shared around with people for interest. In terms of the workforce board, we meet on a monthly basis. It feeds up through the internal governance structure within adult social care. I can again share that governance structure with yourselves as well. There's a very detailed action plan that sits underneath the workforce strategy, which is monitored, reviewed, which is why we have the swap audit in to make sure that we were on track, that it was realistic, and that we were achieving what we needed to achieve. We are constantly reviewing the pay rates in terms of where we are. We're sort of average. We're not the highest, we're not the lowest, and sometimes in terms of starting rate for individuals. So if you look at a social worker, for example, they may well start higher in other local authorities, but actually our bracket, our scale is slightly higher. So by the time people work their way through, are on a higher sort of pay scale. There's a lot of work going on in the Southwest regionally at the moment. Myself, I'm linked in with the regional Southwest Deputy Directors Group, and we're really focusing on that pay and rewards and terms and conditions, because what we don't want is trying to minimise those people moving from Somerset to Devon for a few extra pounds. Actually, what else is it? What else can we do? So we're really looking at that retention, recruitment and retention, both in Somerset, but also across the Southwest as well. And there's more work that's been done on that alongside ADAS as well. So again, I know we've got a really packed agenda in terms of for scrutiny, but I'm more than happy to come back and just provide updates surrounding that. The other thing that we are doing as part of the adult social care operational restructure is at the moment we've got quite large teams. What we're really looking at is going into much more smaller teams, so they're much more place-based working. So therefore, it's a smaller, more supported team. And what we do know for people that are working within adult social care is that place-based working is where their roots are, it's where their values are. So rather than these large teams where you have to wear so many hats because you're working with so many different types of people, actually becoming much more profession specific is is much more valuable for people. And that's been the feedback that we've had from our workforce. Does that cover most of pretty much
I think so.
everything?
Thank you.
Thank you.
Thank you. Councillor Bruce nicked my question, so I was going to ask you the same thing. So thank you for that. That saved a bit of time. Thank you. Councillor Woods.
I knew I should have got my hearing aids in. I didn't hear what you said. In terms of what you're doing now, I understand that you're having more commercial teams so that one employer is employing the carers going in, and you get your carer coming through a third party. So I wondered, as a carer myself, I rely on people that more or less been recruited from micro providers. Are you actually stopping that, or are you actually helping with having teams in which perhaps only spend 15 minutes with a client rather than, I mean, I have an hour for my complete care each time? I wondered how that's impacting the amount of time that the carers provide with people, because it was at a stage where you just got 15 minutes, they cleared off, and the carers have to carry their travel time, which is very difficult in our areas because we are rural. So, you know, you have a carer come in and then the next one might be another 10, 15 minutes away. So I wonder if you're finding that you're using more commercial carers than you were.
Oops, I'll pick that one up for you, no problem. So I can't quite understand the commercial care a bit, but let me explain what happens. So we have a lot of care providers out there. We also have our micro providers, all offering something slightly different. We never commission 15-hour slots, 15 minutes, 15-minute slots. We just don't do that in Somerset, and we won't ever do that in Somerset. That's a given. Some providers play travel time, and actually most of the ones that we now commission are all playing travel time between visits, because that's really important. Because what we can't say is, sorry, you do your half hour here, you don't get paid for your travel, and then you do your half hour. So we've talked up with our providers, and if they didn't, they would lose. Their staff would move around those providers. So what we're trying to get is a standardised. We can't tell our providers to standardise, but the majority of providers that we're working with have a standard way of working, so they will do that. But actually, it's about somebody's assessed needs. So when we're funding somebody's care, we'll do an assessment, and then we will work out whether that's a half hour, an hour, or whatever that visit looks like. What we're trying to get to is a real conversation with our providers about saying, look, this is the needs that individual would need to be met. Go and work with the family now and work out how best to do that. Because some families will say, actually, I'd like this, or I'd like this, or I'd like this, or it's not necessarily time specific or whatever. So it is about now us working with our providers saying, you know, this is what the outcomes of the individual would like. Sit down, work with the individual and work that through. But we never do 15-minute slots in Somerset. You will hear that elsewhere, but not in Somerset. It's not appropriate for that.
Thank you very much, Mel. Okay, we're going to go to our last question now, and that's online with Councillor Christine Lawrence. Welcome, Christine. I know you couldn't make physically here today, but it's good to see you.
Good morning. Thank you very much. Great debate so far. Very good. I did actually go to the Eats Taunton day in just a couple of weeks ago, and the Proud to Care team were excellent. I have to say they were really engaging, and hopefully they converted and made some people think a bit more about the care teamwork that there is and how much is the need for care throughout the county. And it worries me greatly that young people, including my grandchildren, I spend a lot of time talking to teenagers these days, they don't see the care provision as sort of something they're interested in. They want to be psychologists, radiographers, they want to be climate change experts, they want to do everything. But seemingly they don't get the message how important and how needy we need more people to care in all levels of care. And they're not getting that message. And I'm sad about that. And I think there must be some more conversations we can have to make these people feel valued, wanting to go into care. that want to learn about how to do things for people to make life better for them. I think there's some wonderful challenges there, but they're just young people these days. I don't think it's their fault. It's just the way things are. It doesn't seem to be the in thing. And yet we all need care at some time in our life. We all need support. And we have some really wonderful young people, I have to say, but they're not really thinking about their options in that situation, which I think is really sad. So I'll leave that with you. I don't think it's an easy answer, but I wish there was more conversation between education and the workforce so that we do try and explain to young people a bit more about the needs and the options and the possibilities in the care industry.
Thank you very much, Christine. Thank you. That's really good. Well said. I'm just going to say something to Emily, if I may. Emily, do you think that it's about the pay? I've spoken to lots of people in care and they say the pay is very poor and it's not attractive, although they love that job. My grandson yesterday said to me, Nan, when you turn into a potato, well, never heard that before. I think you ought to come and live with us, he said. My daughter was absolutely horrified and she's moving to South Africa, but no, she's not. But, you know, but it is that kind of thing where young children are thinking, they are thinking about things, but they don't know. But going back to a sensible thing, do you think it's the pay?
I think pay is a part of it. I don't think it's the only part of it, though. And I think if you look in terms of what it's that career structure as well within, and that's not anything that individual local authorities can resolve. This is a national picture as well. And when the care isn't necessarily seen as the same equivalent as, say, the NHS, for example, but the care market is a much larger. But it's also, I think, those videos, the Proud to Care videos, are fantastic. And if you haven't seen them, I would really strongly encourage you to go and watch them, because this isn't just about working with older people. This is also about working with younger people coming through transitions, or people with a learning disability, people with mental health needs. And I think that is about also the promotion of the variety of what you can, of individuals that you can work with and what you can learn from individuals as well. So I think, yes, pay has an element to it. I think there is also something about a formal career structure or formal profession, and then the variety, and people not thinking that this is just about working with older people, but the variety and the scope and the difference that people can make to people's lives as well within these roles and the opportunities that it gives to people.
We always need to lift the ante up on this sort of work, don't we? How essential it is. But thank you very much. Councillor Shearer.
Forgive me, I always manage to come in on meetings that aren't mine, so I really appreciate that. I'd just like to thank Councillor Lawrence for saying what she's saying about getting young people into the caring profession. It is a caring profession. I was absolutely bowled over with all of the work that went into Proud to Care, but the reason I put my hand up was that because I've now sort of jumped ship, as it were, and I'm now going to be within Children's, and I think this is where the executive as a whole, the council as a whole, can make sure that we stitch things up and we join things together. And certainly the work that's going to go on, bringing young people's careers and looking after young people and encouraging them to have that ambition to do different things. I will be banging the gong for care as a really important pathway for people career-wise, because the value is really there. So at least I just wanted to say thank you, Christine, Councillor Lawrence, for mentioning it. But I think we can do things working together, I think, also.
Very much. Thank you, Emily, for today. This is about providing updates on and obviously we're going to if you need to make a recommendation to the report. What I would like to take is that offer up of you giving us an update, and I'll make a note of it, that I think to come back in 6 months, perhaps to give us an update on the workforce, let us know what good things have happened. Just to give us a general one. I don't mean it as long as this, because I appreciate, but I just think for us to know, are we moving in the right direction? I really think that. Was everybody happy with that? Everybody agree with that? Everybody? Okay, is that okay? Lovely. Thank you. Do I need it? I don't need a, no, thank you so much. Thank you. But thank you for the work you've done. It's been very, very interesting. Thank you.
Sorry, Chair, if I could just interject there. We've had a request from one of the online listeners, if those speaking could speak directly into their microphones. There is sometimes struggling to hear at home, so thank you.
We could turn our microphones off on our turn the sound down. That really helps as well on there. To be honest, I didn't do it, so I've done it. So, I'm as much as fault. Okay. Moving on to item 7 now. This is the adults and health transformation. Item 6. This is on pages 27 to 58. And I'm going to hand over to Anna Littlewood and Mel Locke. Oh, and obviously, I'm so sorry. Why do I keep forgetting you? And
I'm little and I'm sitting in a corner being quiet.
You're called Dean. No, maybe you should have been. No, forget it. Anyway, thank you. Over to you.
Thank you, Chair. As you will see from the report, basically in last year, we could see the increase in the adult services of £26 million. And quite rightly, we agreed to go into to look at how we could make some savings, because obviously adult services at that point before we took over the districts was 50% of our budget, or near 50% of our budget. Now we're all together, we're actually only 38% of our budget, as Mel would say. We're a little bit less than we were, which is great. It was becoming quite unsustainable, the level of so what we've done is we've commissioned a Newton Europe to look at our program. Not yet, but we are going to commission them to look at our project, and to try to make some savings within the adult services. And I will hand over to Mel now, who will explain it much better to me.
Thank you very much.
So just to help Dean out, and Dean has only just started in the role, so let me help you out with that. So the purpose of this today is not to say that we have commissioned anybody, because that's not what we are. What we absolutely know, and please take it this way, is adults need to have a transformation programme. You heard, and it really follows really nicely from the workforce programme, is that we need to make sure that in a way we transform our services. We knew as a council, as you clearly said, is year on year, we need more money coming into us. We will always need more money coming into us because of the variety of areas that we cover, but also the fact that the majority of the funds that we have in adult social care is spent on the people that are out there that you're supporting. So this isn't on anything else but the person that is either getting their domiciliary care, that young person that is with a learning disability that is needing lifetime support, or our older population, which is growing, and the need for us to continue to do that. But what we need to do is think about how we do that. So this is really about our adults transformation programme. So we've got the slide deck there. Could you pop that slide deck up, please? That's okay, no problem. I'll talk while you're finding, that's not a problem. So as we know, the adult social care budget has grown this year to 186 million, and it is growing year on year. As Dean said, it's 38% of the council's budget at the moment. And the drives to that are the growth in demand, in demography. We know we are an older population. We've got a growth there. It's the complexity of need. There is a really long tail from COVID, which we expected. And that's for many reasons that we've got that. Some of that, thank you. If you go on to this next slide, it'll be great. So some of that is about, you'll hear there's lots of waiting lists in our NHS. And actually that's for simple operations like hips, like knees. And what's happened to people is in COVID, they've sat at home, they haven't gone out, they haven't moved as much as they needed to. And then when they're going into hospital, they're probably deteriorated a little more than they would have done. They go into hospital later and they need more support when they come out. So we know the complexity of individuals has been an issue for us. And the cost of care has grown. We know the cost of care has grown, the cost of living has grown, so therefore the cost of care has grown and the pressures that we put on that. So what this is all about is controlling some of that growth by improving people's independence. We absolutely know if people can be as independent as possible at home, with the community supporting them, with ourselves supporting them, the more we can do that, it's better outcomes for individuals, but actually for all of us, it also saves us money. So it's about delaying the need for long-term support. It's better for us, as I've said, and better for the budget. Adults growth control that we've got in our budget is 10 million over the next 2 years. So it's a saving targets that we've put in. And what we want to make sure is that we can achieve that. So if you'd like to move on to the next slide, please. I won't really highlight the economic value, because I know in your workforce that you had before, we talked that through and Emily highlighted that for us. But what we can say is that care brings lots into our local area. So if you work in care, you know, you tend to spend your pound in that local village, that local town. And actually, we just need to keep making sure that everybody understands the economic value that social care brings to society. So what we did, if you'd like to move on to the next slide, please. What we did was we decided as an organisation to bring a partner in to do a diagnostic for us, to have a look at adult social care. And Newton Europe came in to do that diagnostic. We did it with us, and we did it from the ground up. So how Newton work and how they work for us is they met with all of our teams, actually, with some of the councillors sat around the table today, but also with our social workers, our carers and our support agencies, to just say, actually, what could we do differently? There's nothing in this diagnostic that I didn't expect to see, which is a real bonus. You never get anybody in to support you if you don't think you're going to get the right answers or the answers you need. So I'm really pleased that my team, we got the answers we expected. But what it talks about is improved outcomes. And you can see on the slide, it's a little small, so I hope you can see it. But they looked at 3 areas that we think we can make some savings on. The first one is all around productivity. It's all around improving the environment in which our practices operate. It's about making sure we give people the right tools. It's making sure we give people the right time and the processes to access the right services and to help people to maximise their independence. We expected productivity, process, and the time in which we deliver. So there's some work around doing that. The other one is around ensuring we have the right care available in the right place. And this really focuses our work on people with a learning disability, people with mental health and physical disability. It's all about gaining, so we talk about independence, but we also need to talk about a progressive, more independent care settings where people can achieve, and those that draw on our services can achieve the best life they want to live. They can achieve those independence, and that's by looking at people, enabling people to make sure they've got jobs, less constrained way of working. And there's a lot we can do in terms of learning disability services in that way. And the last one is around optimising our intermediate care. You might think, what are we talking about when we talk about intermediate care? And those newer members here, when we talk about intermediate care, that's about, and you'll hear it quite often, and you'll hear it more and more as we get into winter, it's about how do we support people to leave hospital. So they've been in hospital, how do we support them to leave? You'll hear that horrendous term bed blocking, which I think we should ban, but anyway, that term about how do we help our older population leave hospital. We have a system in Somerset called an intermediate care model that supports people to discharge from hospital. And there is a lot of work we can do as a system, but in adults together, to help us make that more efficient, to improve it, to help the flow, and to again make people more independent. They're the 3 areas, but what that came to is actually telling us we could save. We asked to look at saving 10 million. This says we can probably save 14.2 million with a stretch if we absolutely pushed it to 17.2. So I'm saying let's go for 14.2. Forget the stretch right now. If I can get us to 14.2, we'll be pleased about that. But there is a stretch possibility. If you move on to the next slide, please. I'm not going to dwell on this, but I've put it in your paper for it. This is why you can see we're looking at and the possibilities of those savings that Newton identified with us. So if we move on to the next slide, these are the options. So we've got some options, and it's the options that I really welcome your scrutiny on today. We have a preferred option, but I'd really welcome your scrutiny on the 3 options we've had. I haven't put, and sometimes you see 4 options. The first option you often see is do nothing. Well, I haven't even bothered putting that on because we can't do nothing. The growth that we have will continue to grow. What we need to do is support that, is change that growth. If it's growing up like this, we need to flatten that line so that we continue to ensure that the council has the budget that we need it to have to be able to deliver appropriate adult care services. So we didn't look at that, but what we did look at is delivering this transformation in-house with our existing capacity and skills. I'll be honest with you, if there was not any other transformation happening in the council, we may well be arguing with you, actually, this is the biggest thing you need to do. This is a huge amount of saving. Let's get on with doing this. But you will know, as 5 councils have come to one council, there is a huge transformation and savings target associated with that, a massive target. And I think the majority of the skills that we have in this council are being used to deliver that change programme. So I'm not convinced we've got the right skills in capacity skills available to deliver that for us. The other idea would be that we actually, and point 3 on here, is we go out to another organisation and we say to them, can you come in? Can you do a diagnostics? Can you have a look at the diagnostics that Newton has done? And can you join us? You may get an organisation out there that could be slightly cheaper by 500,000, by £1 million, but actually they would want to do the diagnostics again. And we know that from where this has happened elsewhere as part of other organisations. So there is that possibility that you're welcome to debate here today. Oh, there's the third option, which is, or the second option here, which is our recommended option, which is around us continuing to have Newton Europe as our strategic partner, to bring them into us. Now, what would that offer us? Well, what that would offer us is a team of 15 staff. So that was something that somebody asked us earlier today. What would that bring? It would bring 15 new people. They would work with us for about 14 to 18 months, but they would not leave us, because the contract would be is clearly tied up in that way, until we had saved that 10 million guarantee. So there's a 10 million guarantee as part of this saving. It's going to cost us, and it's a one-off fee of 3.5 million per year over the next 2 years. But this would guarantee a 10 million recurring saving year on year, and a potential growth in that, as I've said, 14 million you may get to. I'm not, or possibly if you really stretched it, 17. We've already directly procured them under an existing framework, so you wouldn't need to go back out to procurement. The other thing that's really important is that skills transfer. Those of you that don't know Newton Europe, and why would you know Newton Europe as a provider, as an organisation? They are an organisation that is the leader in adult social care change in the country. They are used by this government and many other governments in the past to actually help and build and design. And if you look at the paper that is submitted as part of this, you will see where I've gone to many other councils that have had them in this and got the guarantee from those DASs, those 151 officers and those execs in the team, which tells you the savings that has been achieved in all of those areas. So I haven't found one organisation yet that hasn't made the savings targets that they said they would achieve in the timescales they said. There's one organisation, and I'll be honest, it was Cornwall, that didn't make the savings in that period of time, because they only did the diagnostics there. So you may well hear, oh, Newton went into Cornwall, didn't make the savings. They didn't. They left after diagnostics. They got another organisation in to come and try and do the savings. That hasn't been achieved. And lo and behold, 3 years down the line, they're back in again to try and support them. So you can see that happening. The other council, Kent, that they went in to do some work in, they went in pre-COVID, did their diagnostics. They then paused during COVID, because you will all know the bottom fell out of the domiciliary care market. It was really difficult. A year later, they went back in. They have made all of those savings now that they were required to make. They didn't go. They stayed to make those savings. They had a year gap out, but they made the savings in those times. They'd also look at transferring skills. Now, yes, we do have an in-house service, but it's always great to bring the experts in from elsewhere to help and to augment what our knowledge and skills are in our change and transformation teams here. And I think they could bring an awful lot in to help us to learn, to look at our systems and processes, to probably slim some of them down, and to say, actually, this is how you make change. This is how you really make change happen, because we're the experts in that. So they will do that transference of skills as part of that. That's clear that they do that. There's always a little worry when we give all of those skills to our teams that we do lose them, but we've got to give them the skills so that in the future we're not going to need to bring consultants into us to help us do that, if that is the decision you make. So the rationale for the recommendations I've really described a little bit already. So if you want to go on to the next slide, thank you. It is about, they are a good delivery partner. We know that. We know they've got a track record. They make results at pace. I talked to one of my DASs who'd been Newtonised, is what we call it in the service, to be Newtonised, and she said to me, God, Mel, it'll be tough. Don't expect it not to be tough. You're not used to the pace of change. You may say you change at pace, but wait till they come. If you get them in, they will change that pace like you won't believe, but it'll be good and it'll get the service where it needs to be. So they are our leading partner. As I've described, there is a contingency model guaranteed of at least 10 million recurring savings. There's a track record of benefits, financial impact and rigour that I think this council will only benefit from. If we mobilised quickly, if you choose to go down this route, you'll see a delivery at end of year 2 is that 10.4 million. This is a 4-year programme of change. It's not going to happen overnight. Nothing changes overnight, particularly when we're looking at changing the whole system. So alongside this, if we're looking at also supporting our health system to change at the same time, there's quite a bit of behavioural change management that will need to happen as part of this process. So we know that's part of the process. Let's move on to the next slide. I've popped in here just so that you can see it, the contingency model of delivery, so that you know that unless we get to where we get to, they won't leave us. But actually, if everything went wrong, you can see what we have as part of this is if they don't achieve the amount we do, we don't pay them for achieving that. So there's something in there to help you with that. And then there's the governance, because really important is we govern every project. And somebody asked us before about governance. As we would always in adults, we would have a transformation programme and a mobilisation of under our governance structures that we've got. What we also have in adult social care is something called our performance and improvement meeting, which our lead members are used to come along to, and our new lead member will also come along to. And that's a monthly meeting where we scrutinise where we're going, where we look at what our transformation's looking like, where we're really clear about have we achieved the milestones we achieved. Our finance teams are in there, our business partners are all part of that. So as a council, they will scrutinise me and our team as part of that process. We will also report to the new Transition, Transformation and Change Board. That will also be part of it. We'll report there to say, actually, has it changed? Have we delivered if we took on Newton? And then we obviously consider, given that independent programme management process, we'll make sure that we look at somebody within the council, not just in adult social care, who helps us manage the contract. There is something about we need the expertise to help us manage the contract side of things if things aren't working. So again, we've looked at how we can do that. We'll also report through to the MTFP board, and again, we'll make sure that that board is holding us to account. And again, our MTFP position gets looked at here as part of scrutiny. You do that on a every other month basis or a quarterly basis, so we'll continue to do that. And aspects of this programme would also report up to the delivery boards of the ICB, so part of that structure. So if we went down this route, that's what we would do. I'll pause at this point and let you ask any questions you would wish to do so.
Well, thank you very much, Mel. It's whistle stop, but my goodness me, jam-packed, absolutely jam-packed. So first on the list was Councillor Sully.
As ever, a very clear presentation of clear points. I always want to be supportive of everything you do, but I do have some concerns. You mentioned about productivity being a key factor. So there's three questions really, three parts to this question. So how are you going to measure improvements to productivity, and how are Newton going to measure that? Isn't underfunding over a number of years part of the big picture here, that funding gap? So are you trying to, are we setting ourselves up to fail because we're cutting from a gap that we already had? So the second question, are we setting ourselves up to fail? Third part to my question, savings, the incentives are there for Newton to make these savings. What are the risk factors of the consequences of those savings to people's lives and services? Thank you.
Okay, let me start with the last one first about people's lives, because that's the most important part for me, as well as the savings and keeping a financial grip. So if you do the right thing for people, I guarantee that savings fall out of that. It always does. In all that we've always done is do the right thing, keep people in their communities. So this, on my own, and Newton would be a partner working alongside us. So, you don't bring a consultant in to just do it all for you. What you bring a consultant in is to bring their added value, but also to support us as a team. But, the SROs of that will come from the managers that we have in place here. They will own it, they will run with it. But if we do it right for people, we know we get the right results, but we can't do it, as I said, on our own. This is about, we've got the LCNs developing, we've got communities developing. This is about how communities also help us to help people. So the only way adults is going to save you money and be the best service it can be in Somerset is if our communities also support us. So some of this will help us to develop that in that way. There is a budget gap. There will always be a budget gap for us as councillors, and you'll always have to make difficult decisions. But what I need to be able to do is make those decisions appropriate. So I think there is some money in adults to make. I wouldn't be sitting here today if I thought what we were going to do was be detrimental for people. I think what we can do is make it better for people. Often by doing less for people, from a spend point of view, from an adult social care point of view, using communities and families and others to help people, you will find a better solution for individuals, without a doubt. So I think there is ways of doing things differently in that area. And then finally, in terms of productivity, I'll step back up. We can always do things better. Our productivity could be better. There's no doubt about that. We can see it. The restructure that we have in place will help that productivity. As we go down to working neighbourhoods, that will help that productivity. But it's always great to have somebody in to come and have a look at your systems and processes and do some of that mapping and say to you, actually, if you tweak that, did that differently, you could sort this out. So there is always some productivity that I would expect to see as part of it. That is not flogging our workforce to death. So please, that's not what we're about. We're about saying and setting some standards for our workforce, which says this is what we expect of you, and this is what we need, and this is the support we will give you to get there. So that's the aim behind it.
Thank you, Mel. Thank you. Councillor Osborne.
Thank you, Chairman. I'm going to go back to the question that I asked as part of workforce planning, was how is bringing in the Newton staff, how is that going to impact on your workforce? That would be my first point. And also in terms of how is it going to work in terms of sort of line management and accountability? Because if you've got 16 people coming in there, are Newton going to be having some line management responsibility in order to deliver? And how is conflict going to be resolved where Newton might, because they're obviously working on to achieve a target, with financial consequences if they don't, if that conflicts with the views, say, of the staff member professional on the ground? And also, what is going to be your comms plan? Because I can remember when we went over to Dimensions or Discovery, when that change happened back in sort of 2017-18, it raised huge concerns, particularly in terms of users, in terms of how it was going to impact them, and in terms of staff. What's your comms plan going to be, and how are you going to take people with you?
Okay, so let's start with the comms bit first. So it's very, very different from Discovery. Discovery was moving the whole service and in essence, outsourcing that service to a new provider. This isn't about this. And Newton are a consultancy organisation that will come to work with us. They have already, as part of the diagnostics, been meeting our teams, going to our team meetings and sitting down and working with them. They will manage themselves. They won't have line manager responsibility over us. We will work in partnership with them. So we will be a partner. The governance routes to that will be through my senior team. So when they came in last time, they came to my directors meeting on a weekly basis. We talk together. What they can't do is decide to make savings on things that we don't agree with. It's a partnership working together. We've come up with this as a team and have signed this off both from a financial point of view, from our point of view, from a HR point of view. It's been a collective alongside our members to share with those lead members at that point. So it isn't about coming in to do to, it's about very much doing with. So what they bring is that added skill set, that added capacity on change and transformation that we certainly don't have within adults. We don't have the capacity within the council. And also, I think they will bring their expertise as part of that process. So it's about working with us and working together, not about doing this to us. They won't be able to do to us. I think the other good thing about Newton and the other advantage we would have with them is they're not going to leave us till they've made the savings. If they don't make the savings here, they ain't going to get another gig in the Southwest. And they know that. They know that very well. I chair the Southwest ADAS group, so they know that I'll go and talk to my other directors in the same way to get assurance I've gone and talked to the rest of the country's directors that they've been in. So there is something. The other part of this is if we have an independent, not from adult social care, independent within the council, individual that is holding this contract for us and got the expertise in that, which we have, that will also ensure that our contract is nailed in that way, not with me doing it, but with others doing that as part of the process.
Very much. Can I go to Councillor Woods, please?
Yeah, I wondered if finance could tell me, and my memory fails me there, how much we've already paid to Europe for the diagnostics. Because that, I think, is quite important, because we were guaranteed a return on that. So I wonder how that worked out.
Shall I start for you and then you can have it go for it? So there's no guaranteed return on a diagnostic. The diagnostic was to get us to where we got to. What we did guarantee, there was no guarantee on the diagnostics. There never can be. What the diagnostic is about finding out what we can do, and what the art of the possible is what we've done. As part of that process, yes, there was a cost to that. I will double check with my team. That will then get paid as part of this process. So what we say is, the guarantee was, if they then go on to implement, they will, that cost, we won't need to pay that cost. That will form part of the process we've currently got.
Hi, Penny Gower, Finance Service Manager. The cost was £500,000, just below £500,000. Okay.
That was I thought it was just under £500,000, but I thought we were also guaranteed some savings under that.
Hi, it's Anna Littlewood, Deputy Director for Adults Transformation here. So you do the diagnostic on the premise that you pay for that diagnostic. If you then choose not to proceed into implementation with Newton, then you just pay that 500,000. Thank you very much. We've discovered what we needed to discover in terms of, what the opportunities they've identified. If you then go with them onto implementation, what they then do is, what we're working on is that guaranteed recurring savings. So they will work on a factor against the fee. So we're saying the fee for implementation is 3.5 million for 2 years, plus the diagnostic amount. And then they put a factor on that of 1.3. So if you stay with me on the maths, 1.3, a factor of 1.3 on 7.5 million, which is the total cost of everything, takes you to that guaranteed 10 million. So they are guaranteeing 1.3 times the total fee in recurring savings year on year on that one-off cost. So that's probably, Rosemary, when you got into the detail of the diagnostic cost, is what you remember. Yeah.
Okay.
That explains that.
Thank you. Thank you. Right. Thank you very much. Thank you for answering all the questions, Mel. I think, oh, hang on. Okay, last one. Councillor Bruce.
Thank you, Chair. Yeah, when I see something that sounds like it's too good to be true, it generally is. And this is a little bit, I've got some alarm bells ringing in my ears. Are there no conditions in terms of, they say that the guaranteed savings, but if they tell it, you said earlier, if they tell us to do something and we don't want to do it, we don't have to do it. But if they give an instruction, say, to make these savings, you've got to do this, and we turn around and say no, does that give them the possibility to say, well, you haven't made the savings because you didn't do what we told you to do?
So the savings that we've got on here, we've already said yes to them with. So it's not saying that we've already gone through what we've said, and we both agreed this. So if you go to slide 5, jump back to slide 5 for me. You'll see on slide 5. Yeah, there you go. We've identified the areas together, signed off by our finance team, looking at our baseline, agreeing actually these are the areas together we think we can make the money on. Now what they will then do is if you agree to having them, they would spend now probably the next 4 to 6 weeks really going deeply into all of these. So you may say, actually, on one slide it says 2.8, but actually once we've done the deep dive, you can make 2.4 there, but you can make 8, you make a greater number in the one above. But we know that within this area, there's about 4.2 million that we can make in these savings. We know that already. We've signed up to it. But we work really closely with them together. It's not a team that comes in and tells you what to do. It's a team that we work together and say, actually, we think we can make these savings in this area. Let's work out the how. What they'll do next is do our milestones. They'll identify all of that, and they will come up with a really clear plan that we will sign off as part of that process. I suppose the only area of risk, and there is always areas of risk, is in order for us to do that, we still need some internal support. So what we've done already is talk to our team, and we've worked out this is what we'll need within the council to help support this. This is what we'll need within adult social care to help support this. So we know that already. The transformation board, I took this to the transformation board last week or the week before, and we sat down there and agreed that we would need a bit of additional finance support to be able to do this from the council, a bit of a different performance support to help us to do this, so that we can guarantee anything we sign off in the same way we signed this off, that we agree with and we do together. So that's the bit that is part of the process. Yeah, please do.
You can, but I really want to make this, because we're conscious of time. We've got two bigger meaty things on there. So is there anything, is it relevant to?
Yeah, I suppose that the one of the risks, for example, is the workforce that we're talking about. So if you know, if we don't have the right workforce, we're not going to be able to implement the changes. And the other is we seem to be depending a lot on the fact that we're moving away from one model to more of a community-based care. We're going to be relying on community organisations and families to step up and provide some of the care that the council have been providing up until now. So just wondering, are you bringing on board those community organisations at this point, later? Sorry, yeah, that's it then.
So our community organisations are working with us now. We continue to develop and work with them to help us continue to do that. Part of this will be this. This isn't something that happens overnight. As you can see here, this is a 4-year programme of change. So everything isn't going to happen tomorrow, the next day, particularly the learning disability piece along here. So if you look at the learning disability one, we know savings of that probably won't come out till year 3 or year 4, because it takes time to bring people along with you to develop and to work differently. But there are absolutely key savings we can make in terms of our intermediate care model of delivery that we've got now. The cost of that model is massive. We can absolutely make savings by doing things differently there.
Thank you.
Thank you for that explain. Councillor Shearer, did you still want to come back, or is that explanation fine? That's really good. Thank you very much. Councillor Osborne, this is going to be the last now on this item, please.
Councillor Bruce partly went there with what I was going to ask, which was actually, when you did part of the work, how confident are you that there actually is sufficient capacity within the community to take on the extra roles that seem to be coming its way? And how are you going to ensure that the capacity is sufficient in all areas of the county? We know that some areas of the county are better than others.
It's not just down to me to support and deliver. That's down to each and every one of you. You live in your communities. You pulling your communities together is probably something that councillors do really, really well for us. So that's part of how we get councils to, how we get everybody to work together. We will do that with our voluntary organisations. We have already a massive voluntary organisations that support us through our Community Connect, through our village and community agents. As we continue to grow that, and they're absolutely ready to grow with us in that area, we continue to do that. We're not expecting people to do things that we already do ourselves. Where we have a statutory duty to deliver, of course we will deliver that and continue to deliver that. But if people also are living in their communities a healthy and good life, then actually they'll need us less and less. If we can make sure that when people come out of hospital, we re-able them really well. If our re-ablement services supports people when they start to wobble in their homes already, when we don't have a service that delivers that, that prevents people going into hospital. There's something for us about how we deliver prevention alongside our health colleagues. So this isn't us on our own. This is with health colleagues through our neighbourhoods, through working differently. We are all, whether this be ourselves, health or communities, signed up to delivering differently. This will help us to do that quicker and faster than we're ready to do now.
Thank you, Councillor Osborne. That was a good question. Thank you, Worthy. I've just noticed that we have Councillor Lawrence. So this will be the last one. Councillor Lawrence, are you still wanting to speak?
Yes, I'll be very quick. If that's all right with you. This is a very important item, I have to say, and there's been tremendous pressure on this budget for years. It's always been difficult, and you have to stop once in a while and say we can't go on like we are. We've got to think out of the box to find the way, to find the funds we need to use in a different way to be able to do the things we need to do, because the pressure of us all living longer, which is fantastic, we're all living longer, but at some time, as I've said many times, we need help and we need support, and we need the right support in the right place at the right time. So, and I've had many conversations with Mel about this in the past. It's always nerve-wracking to start and change things because you always feel, oh my goodness, am I doing it right? If you don't change things, you're going to be in a bigger mess than ever year on year. So I don't want to rush into anything, and it isn't been a rush, I can assure you, but I do think this is a very good process. But I'm very glad that in point 32, pull out and termination is there. We need to monitor this like everything and anything, on the ball all the time, checking, making sure, like Mel says, we're doing it together, not separate, together, so that when there are hiccups, you can deal with them. But there is that monitoring clause, the termination clause. If all else fails, we pay for what we've had and we can go back to doing things the way we want to do them. So there is that termination clause there. I hope we never use it. I hope sincerely it works, because if it works well, everybody will benefit.
Thank you very much, Councillor Lawrence. Absolutely right. I feel like this is a scrutiny within a scrutiny. So I'm hoping, yes, let's hope this works. But thank you for your points. That's absolutely excellent. We have 3 recommendations. I don't need to read them out to you. I think you all remember them, unless you want me to read them again. Everybody happy? Yes. Okay, 3 recommendations. So are you happy for them to carry on with those? Are you all right? Do you want me to read them, just to remind everybody? Maybe I will, okay? The first one is the aims and objectives of the next phase of the transformation programme for adult services. The next one is to engage Newton Europe as a strategic change partner to work alongside the service to deliver these transformational objectives by implementing the opportunities identified in the diagnostic and support the delivery of identified reductions. Excuse me. To fund the costs of the transformation programme of 3.5 million each year for the next 2 years, initially from earmarked reserves, and review the position later in the financial year once the 22-23 statement of accounts from the predecessor councils have been completed. Are you all in agreement? This is the way forward. Anyone against that? Councillor. Oh, Councillor Wood, sorry.
I'm concerned that we haven't got I don't know, have we got the finances from last year settled now? So I'm not quite sure that we've got the finance to actually do this.
May I ask for Councillor Lisham to come in, please? This is the lady who will know everything.
Chair, you do understand about expectation management, don't you? So I'm speaking as lead member for finance and performance. So I've been listening very carefully. This is obviously a very serious decision that will come to the executive for the actual decision. It's not taken yet. The decision was taken to continue to undertake the diagnostic work as a partnership with Newton Europe. One of the things that is of greatest interest to me in any contract working in a partnership way is sharing of risk. And so that's one of the things that I most welcome here. The outturn for each of the 5 councils is going to come, I believe, to executive in July. So we don't yet have the outturn figures for the county councils last year and the district councils last year's, although we have good indication because we were monitoring at all of those councils right the way through to month 10, and we know what's happened since then. You'll know also, Chair, that we've moved to the new finance system, Microsoft Dynamics. So we do have ahead of us a massive challenge, and transformation in adults as the biggest spend for the new council is absolutely critically important. So the monies were allocated in the previous year for the work with Newton. If that ended up being the only piece of work that had to then be funded at the end of the diagnostic, the decision we take at the executive, not next week, but the following month, will decide on whether that diagnostic cost then goes into the full contract. Is that right, Mel? Am I getting this right now? Go to Mel on the detail of the contract,
So
please.
contract is coming to yourselves next week. For
Sorry,
decision on.
beg
So
your
it comes
pardon.
on
The decision does come to the executive next week. I think the outturn reports are not until July. So the decision will be taken next week, and the comments from this scrutiny meeting will go to the executive. And then we'll see the outturn reports the following month, but we do have good indications already where we are. And actually, those outturn figures from the county council are the ones actually that make this work more critical, more important, and needing a rapid decision really on transformation of adults. Is that a fair comment, Mel? Okay, thank you, Chair.
Thank you very much for that. I knew that you'd be able to give that clarity. So as you can hear, it does go to scrutiny. We just want to agree what goes to scrutiny. So executive, sorry.
What agree, so we are agreeing what goes to the executive, but not without saying that we need to know that the finance is there to see it through.
Of course, naturally, that would.
Can we add that?
Yeah.
I mean, ultimately, the recommendations will be going to executive whether scrutiny agree it or not. This is scrutiny's opportunity to make any further or additional recommendations that they would like to. Obviously, that would need a consensus by the scrutiny committee itself.
Madam Chairman, can we have a proposer and a seconder if they want to change the recommendations, and have a vote and stop the discussion? Because at the end of the day, this paper is dealt with.
Councillor Osborne.
Thank you, Chairman. At the end of the day, we're not making the actual decision. It is the executive that make the decision. So I'm content to see this paper go to the executive, who will ultimately make the decision. And if anyone wishes to raise any further concerns, they perhaps take those to executive next week. The only thing I would add to it is in terms of monitoring by this committee, that there is a provision in there that there are regular reports along with workforce reports back to this committee so we can monitor its progress.
I think that would go without saying that we're going to have that put in anyway. We're going to have regular, this is something we all want, to regular updates. Councillor Sully.
Just to what Councillor Hobhouse was saying, could our recommendation be around the risk factors? Because that's what's making me nervous, is the risk factors with this. Knowing what they are and how they're going to be monitored, and that our scrutiny can look at those risk factors. So could that be a recommendation? And I think we're hesitating because this is a really massive decision and massive budget and massive consequences on our communities.
What we can do is bring back here regular reports to you so that you can understand what it's looking like. Are we achieving? We'll do that as part of our finance reporting and part of our performance reporting that we bring back on a quarterly basis and a bi-monthly. How often we bring them? I think we're bringing performance, and every other month we're bringing that here, aren't we? So we'll do that. We'll add it onto that part of the agenda, no problem.
Because I think it is important that we all get sight of what's going on, and we all see. Councillor Lation.
Chair, it would probably be helpful to come from scrutiny, just a recommendation that it be a strategic risk on the strategic risk register, taking into account the size of it. I'm sure it's already there. But obviously that's a really clear recommendation.
Yeah, you want that added to the recommendations, right? Strategic risk.
I will need a proposer or a seconder to do that.
Yeah, and councillor Woods is seconding. Everybody in favour, please. Could we show hands?
That's carried.
That's carried. Thank you so much. I'm now going to give you 5 minutes to have just a little small comfort break before we go into the next item. Okay, but 5 minutes. And I'm going to the small place first.